This is Dr. Jim Andrews. You're listening to Interview with a Surgeon by a Surgeon Agent.
On this week of Interview with the Surgeon, we welcome Dr. James Andrews, one of the founding members of Andrews Sports Medicine and Orthopaedic Center in Birmingham, Alabama. He is also co-founder of the American Sports Medicine Institute, a nonprofit institute dedicated to injury prevention, education, and research in orthopedic and sports medicine. He has mentored more than 300 orthopedic sports medicine fellows and more than 80 primary care sports medicine fellows. Dr. Andrews is America's sports surgeon to the stars, treating players like Michael Jordan, Tom Brady, Adrian Peterson, Albert Pujols, Jack Nicklaus, and many more. Dr. Andrews' remarkable popularity among top-tier athletes stems from his 1985 arthroscopic surgery of a young pitcher named Roger Clemens. Clemens would go on to be a 7-time Cy Young winner, credited Andrews with saving his career. Dr. Andrews also is a team doctor for the Alabama Crimson Tide, Tampa Bay Rays, Auburn University Tigers, and Washington Redskins. Hello, everyone, and welcome to this episode of Interview with the Surgeon. We have Dr. James Andrews here. Dr. Andrews, how are you doing today?
Doing good, thank you.
Thank you so much for being with us. So let's just jump right into it. As you know, this podcast is focused on providing education for graduating residents and fellows. So if you can think back and help us learn about your career and your path, what were your goals and aspirations during your residency, and how did those change during your fellowship?
Well, you got to realize we're talking about how things were, 50 years ago. I was very fortunate, and I knew all along that I wanted to be a team physician. The word sports medicine had not been invented yet. And I was involved in high school athletics. And then I was a pole vaulter on scholarship at LSU. And I used my athletic career to really get me into medical school. And in medical school, I continued to know that I wanted to be a team physician. I didn't really realize what specialty I had to get into, but I soon learned that to be a team physician, I need to be an orthopedic surgeon. So I did my residency at Tulane, and of course that was an easy choice because I was at LSU Medical School, and right across the street was Tulane Residency. And during Tulane Residency, I continued to be on a straight and narrow course. I didn't waver like a lot of them do now. They get into the residency and they still don't really know what specialty they want to do. But wanting to be a team physician, I hooked up with a Dr. Jack Houston, who was sort of the kingpin of sports medicine in the Southeast United States. He was a team physician for Auburn University. And I looked him up, having learned about him, and called him up and asked him, could I come visit him? And he was in Columbus, Georgia, and I went to visit him on my weekend off. And he's the guy that really started the early coverage of high school football games on Friday night. Operated on high school kids on Friday morning. So I went over and spent the weekend with him. And then I asked him, could I come train with him? And as it turned out, the third year of my residency was what we call sort of a gump year, where you were mainly being abused and taken care of, mostly operating during the middle of the night. And I got to go to Columbus, Georgia, and spend a whole year with him during my third year. And when I finished, he set me up in fellowships. I did a fellowship at the University of Virginia in sports medicine, mainly upper extremity there, because I'd done mostly knees with him. Then he set me up with one of his friends, Professor Trion in France, who was the father of European knee surgery, and I went over and did a fellowship with him. We didn't know what fellowships were. We didn't call them that. We called them apprenticeships. So it's entirely different. But I had my whole career laid out the way I wanted to do it. When I finished, I came back and went into practice with Dr. Houston with a handshake. Just to show you how things are different then, I didn't even ask him what he was going to pay me to come work with him. I just wanted to work with him because I knew sooner or later I could take it over. And it was a handshake. I didn't know how much money I was going to make until I got my first paycheck. And I worked with him for 13 years. And he was really my mentor throughout all of that episode. But for me, it was well planned. Squeaking wheel gets oil first. And so I didn't waste any time with my career. And as it turned out, I became a sports medicine specialist in orthopedics. So it's entirely different nowadays with these younger residents and fellows.
Sure, that's really interesting. And thinking about going back when you first started your first job, did you always have the dreams and ambitions to go off and create your own institution? Or what were you thinking? What was the mindset you had when you first got started?
I didn't think about any of that. I knew that sooner or later, Dr. Houston would be an umbrella for me when I first started, meaning that he would protect me, and he was well powerful in all of the sports medicine meetings and in the sports medicine in the Academy of Orthopedic Surgeons, and he would promote me. I knew he would promote me because we had a difference in age enough. It wasn't like he was only 5 years older than I was. He was considerably older, more of a father image. So I knew if I hung in there with him, care of the patients that he sent my way, kept my mouth shut, worked hard, sooner or later it would become my empire. And indeed, that's what happened. When he retired, at that point, I had finally the first thoughts of maybe going somewhere else, a bigger airport where I could have patients fly in easier than Columbus, Georgia. And I had people knocking at my door wanting me to move to Atlanta, to Nashville, and to Birmingham, Alabama. And so as it turned out, I moved to Birmingham, Alabama and started my own orthopedic clinic, which we grew into become the Andrews Sports Medicine Orthopedic Center, which is still there in existence today. That move was a difficult move because I had to break away from my mentor and actually a father figure of mine. But at that point in my career, it became obvious that that was the best thing for me to do. Dr. Houston wrote me a note, by the way, as it turned out after it happened. He said, "Congratulations on being so successful in Birmingham." He said, that was the best thing you could do for your career. However, it was the worst thing for me, talking about him. But that made it hard. But sometimes you have to make those hard decisions when you try to make decisions that will affect you the rest of your life and doing what's best for your career.
Absolutely. I fully agree with that. And speaking about that, decisions that you've made, what would you say were some of the keys to your success as you grew throughout your career to be where you are today, which is arguably, one of the most well-known celebrity orthopedic sports surgeons around?
Well, number one, you better make sure you make your wife happy. When I moved from Columbus, Georgia to Birmingham, my wife drew a circle around Columbus, Georgia, because all of her family lived there. And she said, we can move no further than somewhere within this circle. And I had an opportunity to move to Nashville, but Nashville was outside the circle. So I picked Columbus, Georgia. And also, I think it's important when you make a decision like that. It's one thing to, for example, to move downtown Manhattan where you got all kinds of competition. But when I moved to Birmingham, we were already taking care of most of the small colleges in Auburn and Alabama over in the state of Alabama, being right there in the border between Georgia and Florida and Georgia and Alabama. So I knew when I moved to Birmingham, there wasn't the word sports medicine really didn't exist. There wasn't a lot of competition. We had all those small schools and high schools that I'd been taking care of. So me moving to Birmingham was just a natural. And again, I didn't have a lot of competition to be very successful there in developing sports medicine.
That's really great. And now thinking back to all your work that you do with residents and fellows, I know you run a bunch of them through your current institute. What advice do you have for the mindset of the graduating resident, the graduating fellow, as they're deciding the career path decisions that they're going through right now? What are some of the things that you currently provide mentorship-wise to your current fellowship?
Well, I think the main thing that I try to teach the fellows that are finishing now, it's a whole different world. And now orthopedic surgeons doing sports medicine are out fighting over taking care of high schools. When I came along, all the high schools, they had no coverage. So they were easy to all of a sudden take care of 15 high schools, for example, because nobody was doing it. Nowadays, there's tremendous competition. And these young orthopedic surgeons that are finishing their fellowship in sports medicine with me, I try to tell them, when you go into your community, don't go in there as a big shot telling everybody about how you were trained and you're sports medicine fellowship trained and you can do all the latest things and tooting your own horn. Because if you do, you usually get blackballed by the ones that are already there. So go in, learn how to crawl first, walk, and then run. Don't go in trying to make a big wave. Don't go in and put your name on billboards. Watch out what you do. If you try to make your reputation by communication and availability, you'll be successful. Also, you make your reputation by being heavy in research and education in sports medicine. And if you're heavy in research and education, the other people that you're working around, the other orthopedic surgeons that are competitors, can't really say anything bad about you because you're mainly working and making your name through those two areas, research and education. So you got to really be careful when you go out there. I tell some of them, tell them you're a back surgeon because they won't be jealous of you. I also tell them when they go into practice, they've got to be expected initially to do all types of orthopedic surgery. Remember, sports medicine doctors really began as general orthopedists in the private sector. So I tell them, you got to be able to take on all comers, make yourself available. Don't become a superstar hotshot specialist the day you hit a community, or you'll be 6 months before you get your first surgical procedure. So that you got to really watch how you maneuver in a community early on. And believe me, most of these young sports medicine doctors are very aggressive nowadays. So I try to tune them down a little bit. They'll go out there and say, I trained with Dr. Andrews and I know how to do this and I can do that. And all of a sudden they're hated in their community. So you really have to be careful about the jealousy that occurs. Believe me, the field of medicine is built on jealousy from one doctor to the other. That's why we don't that's why we have no real one voice, as a matter of fact, because everybody's worried about themselves. And it's a dog eat dog world out there when they first get out, particularly in sports medicine. By the way, these young men and women that are finishing sports medicine are the elitist of the elite already. And you have to, one of the things I try to do is teach them some humility while they're with me. And we base a lot of our credo and our mission on being humble. And hopefully they learn that, but they still have a hard time realizing that when they finish with all they've been through. And we have one here at the Andrews Institute in Gulf Breeze, Florida, and we take 5 to 6 fellows a year. And we have one at my Andrews Sports Medicine Center in Birmingham. We take 6 there. And we get about 40 applications for an interview, which comes to us in, I forget now, January of the next to the last year of their residency. Actually, we get about 100 applications, and then we pick 40 of them that will, and we notify them that that we will interview them here in Pensacola, or we would interview them in Birmingham. While they're here, one of our jobs is trying to help them get a job, just like you're doing. The other thing we're trying to do is teach them about the legal aspects of medicine, which they probably never had a lecture on before, how to stay out of lawsuits. And then the other one is we have people like Mike Immel here that tutors them relative to their first contract. And a lot of times they have no idea about how to put together their first contract. One of the problems we have with their first job is that, and I don't know where I got these statistics. I'm not sure that's still true, but I know I've heard in the past that the divorce rate of orthopedic fellows that get their first job, the divorce rate is about 70% after 2 years, meaning they leave, they're not happy with their first job and they leave and go somewhere else. That may not be as bad as it used to be, but it also tells you how hard it is to get a good job nowadays because they're saturated. One of the problems that I see that I try to advise my fellows is that when they get their first contract, they need to look and see what's happened to the people that have signed contracts with that orthopedic group prior to them. Because a lot of orthopedic groups will give them a contract until they'll bring them in as a partner after 2 years or 3 years or whatever. And so they make a minimal salary before they can become full partners. And when they get ready to become full partners, they tell them they don't need them and they release them. And they go get a new fresh one again for 2 years. Mm-hmm. And it cycles like that. And believe it or not, some orthopedic centers seem to do that over and over again. So you want to make sure that you don't get caught up in that merry-go-round.
Sure.
It's good if you know what senior guy's bringing you in, and is he going to take care of you and you're going to work under his umbrella because he takes care of you and turns things over to you like a father. So going into a group where you know nobody and you're just going on a contract, you better know more than that. You better know the real history of what's going on with that group before. How many partners do they have doing the same thing as you, for example? And I'm sure you understand what I'm talking about.
Absolutely.
It's a real important decision for them. It's probably the most important decision they'll make up to that point in their career as to where they go to practice.
Yeah, we focus a lot on doing due diligence with our clients, making sure that they understand, asking the questions that you said. It's super important that they're well aware of what's going on. Now, with the way the world is right now, with everything's kind of being done on Zoom, what advice do you have for them as far as how can they continue to network? Let's say when there's not national conferences happening, what advice do you give to your current fellows that are going through the process but not having the ability to be at conferences, to be at annual meetings, and be able to meet folks like yourself?
Well, number one, you should have in your contract your availability to go to certain meetings. And hopefully, as a sports medicine doctor, you should have in there that you can attend the American Academy of Orthopedic Surgeons. That's always the father meeting that everybody should go to. Sometimes one person has to stay home, cover the clinic or whatever. You can't go every year. Then the other one you need to make sure that you're able to go to is the Sports Medicine Society, the American Orthopaedic Society of Sports Medicine meeting annually. And then this third one that you should go to is Orthopaedic Association of North America. And those meetings are essential for you to be and get involved with. And you can follow a resident member of those organizations as fellows so that you're already belonging to that group before you get out of your residency or your fellowship. And you need to patronize those groups because if you're in sports medicine, that's where all the knowledge comes from. Number one, you don't want to start off going to what we call vacation type meetings like a ski meeting in Vail or some type of summer meeting in Hawaii. Those are meetings really educational, in other words. They're more fun than they are work. You want to go to meetings where you work all day long and learn something. So you got to watch what you are doing with your time off. Obviously, your first couple of years, you don't have a lot of time off. It's going to be a rude awakening from their residency where they're forced to have certain time for vacation and all. During our residency, during our fellowship program year, by the way, we allow each one of the fellows to go to 3 meetings, and we tell them what those 3 meetings are, and I just named them for you. That's the only meetings they can go to. And they have to alternate missing one of those meetings, so somebody has to stay home and cover the clinic along with an orthopedic surgeon mentor. But that's the only meetings we let them go to. We let them go to if I'm going to a meeting to give a talk, for example, I may take a fellow or two fellows with me because they're working on my service and they go with me to those meetings. They get to go to some other type meetings, but it's usually just because they're going along beside with me and flying on my airplane or whatever and coming back. So it gives them a little more time at different meetings and meet different people. One of the things they have to do at these meetings is they meet the people that they admire, that they've heard about all during the years, about articles that they've read about this particular doctor, and have an opportunity to rub elbows with them. So it's important to be at those meetings. A lot more important than taking a month off for vacation.
So thinking back in your early career, did you always plan to go private, or did you have any aspect of wanting to go in the academic route?
Well, that's an unbelievably good question. When I say a good question, that means it's hard to answer. But for me, I wanted to go into private practice because that's where sports medicine really began. Sports medicine did not begin in the academic institutions. There was very little interest in sports medicine when I first started by all the academic institutions. Now, that is completely reversed since then. But I knew if I really wanted to take care of Auburn University or University of Alabama, it was going to be done through a private clinic group. And that's where my interest was. But also, I didn't want to get involved in the bureaucracy of a major academic program because I guess I was always headstrong, like to make decisions myself, quick decisions, get them done. And so that led me into the private practice of sports medicine. And with our fellowship program, we really done in private practice what nowadays is much easier done with the university system than it is with the private practice. But when I started, private practice, particularly working with somebody already doing it as an umbrella from me, Dr. Houston, was the way for me to accomplish it. We have a little saying that says, be patient, but do it in a hurry. And that's sort of been my motto through the years. A fellow one time that went back to a hotbed of orthopedic surgeons, a lot of competition up in north, right above Atlanta. He actually played baseball at University of Georgia and was with me, and mainly what we were seeing and what he was interested in was baseball injuries. So he went up there in the community, and they all heard about him coming. They blackballed him. They wouldn't even let him be on the emergency room call in the emergency room. And he was there for 6 months before he got to do his first surgical case.
Wow.
So he needed you.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.